Welcome to day 24. We're talking about increased risk of joint pain today. And it's something that we joke about, right? Like getting old and creaky and injuring ourselves more easily. Maybe you get up and walk around and your ankles or joints just hurt a little bit more. Obviously, we talked about that with loss of hormones. We can be at higher risk of inflammation. We can be at higher risk of leaky gut or intestinal permeability, which opens the gateway to systemic inflammation and autoimmune disease. So let's start by ruling out that there's not some kind of an immune system attack against our joints. I hear a lot of women having pain, especially in their hips, is waking them up at night. And that's not normal. Let's make sure that there's nothing going on that is contributing to that pain. First of all, lowering overall inflammation in the body. Let's look and see what's going on with A1C, with CRP, even uric acid is something that it's usually associated with gout, right? But it's something that's really telling in terms of systemic inflammation, fructose intolerance, insulin resistance, oxalates from foods, healthy foods like spinach or tea or coffee or chocolate getting lodged sort of like little shards of glass in your tissues and causing pain. So let's rule that out. Urinary organic acid test can look at specifically at oxalates, but a simple uric acid blood test can be very telling about a whole host of inflammation and longevity related signs and symptoms. Dr. Perlmutter has done a lot of research on uric acid. Another test that I run on all of the women that I work with in my program is a hormone panel. There's actually not only endocrine disrupting chemicals, but also bone turnover markers. We can look at that in the blood, and this one specifically is in the urine. If you're starting to experience some bone loss and early osteopenia or bone pain, let's absolutely support that with some of the vitamins and minerals you need, making sure that you're getting plenty of protein and collagen, making sure you're moving your body, because the research says that even with rheumatoid arthritis, it might hurt to move, but that is the best medicine. We can rule out if it's autoimmune being positive for ANA antibodies. There's several autoimmune conditions like Hashimoto's, lupus, RA that would show positive antibodies, such as the ANA antibodies. That's something that we could run on a pretty basic blood test. So it's not something you have to live with. Start with movement, start with sleep and restorative activities and joint mobility activities, and start with an anti-inflammatory diet. And then we dig a little deeper and figure out what is causing the joint pain, especially if it's getting in the way of quality of life. It's not something you just have to put up with. There is a reason.